All right, everyone, welcome to the session with Andre Shirdan. I'm super excited to have him here today. Now, if you don't know about Andre, here's just a couple quick things. He is a compelling speaker and storyteller. So, Andre delivers high energy presentations on creating the perfect practice with humor and a genuine, down to earth style. He also lives his message. Now, he reveals simple and effective strategies that anyone can use to get on track, build resiliency, reduce stress, and cultivate a strong dental practice. Now, some more about him. He's an author, inspirational motivational speaker, certified software trainer, CAD CAM, CBCT training professional, and national speaker. He's been interviewed in many places, including RDH Magazine, The Passionate Dentist Project. He's been published in Dentistry Today. On top of that, he's also interacted throughout his career with thousands of dental professionals. So he's the founder of Systems Practice Management, a dental practice management training and consulting firm. Also the creator of the Crew team building and training process, as well as a contributing creator of the companies Dental Life, Dynamic Dental Systems, and HMS. And also he is the co-author of the Periodontal Protocol Stat Check. Now, I'm super, super excited to have you here today. But first things first, I want to make sure kind of people understand who you are and your story a little bit. I know you didn't always start out in dentistry. You even studied fine arts and design, and you originally started out in sales, kind of doing some high-end luxury sales. So kind of tell us more about you and your story and how you got involved with dentistry.
Well, it's a weird story because I started in dentistry really just as a patient, like most normal people. So my brother-in-law was my dentist. Actually, he was my dentist before he was my brother-in-law. And I started in business really in high-end fashion. So I sold Yves Saint Laurent couture clothing. Before that, I sold records, back when there were actually records, LPs. And the record industry actually sent me to sales training through Ritz-Carlton, through Disney, through Nordstrom's. And they taught me like the best of the best when it came to sales and customer service. So when my brother-in-law found out that I had this training, he said, "Hey, can you help me in my dental practice?" And I had no idea what I was getting myself into. And I just said, "Hey, look, let me see if I can actually apply some of the things that I learned spending time at Ritz-Carlton, spending time at Disney inside a dental practice." And my first day working with him, I dropped everything and said, "You know what, that's it. I want to come into dental world and I want to spend my life in dental world." And it's been 29 years as of March of 18. So close to 3 decades applying the things that I learned outside of dentistry into dentistry. And I continue to do that. I spend days, a couple days a year at Disney. Of course, I spend a lot of time in hotels and really just taking what I see outside of dentistry and incorporating that into what we do on a daily basis in dentistry.
Awesome. That's great. So, kind of going a little further into that, I know you've previously called yourself a recovering consultant. Uh, do you still call yourself that?
Yeah, I teeter back and forth between a recovering consultant and a recovering front desk person because I really miss the days working, sitting at the front desk. And that's why, a lot of what I do is really about been there, done that. I've worked chairside. I've held the instruments. My brother-in-law was one of those kind of dentists who, when I questioned how a procedure worked, he taught me how to do the procedure. I mean, we would extract teeth, obviously teeth that needed to be extracted. We would extract teeth. He would mount them in plaster, and then he would have me do the procedures. So I understood why it took an hour and a half to do an endodontic procedure, why it took so long for him to do a crown prep. And then, we'd blow up the margin so I could see what I was doing. And I got a really good appreciation for that. So, I call myself recovering because every day I fight that struggle between, wanting to push somebody out of the chair and actually do it, answer the phone, one-on-one work with offices and really, do the procedures, do the things that I did years ago, sat at the desk, answer the phone, talk to new patients. I love that experience. So I struggle to be a recovering person on a regular basis because I love doing it. And I always fall back into trying to do it. And I spend my days now coaching, which is different. And coaching for me, and the clarification I make between coaching and consulting is, coaching for me means standing on the sideline, wishing you were in the game, understanding the game, but giving advice from